Kia ora, I'm Chelsea Daniels, and this is The Front Page, a daily podcast presented by the New Zealand Herald. More than 36,000 nurses' organisation members nationwide went on strike yesterday, and they will walk off the job again tomorrow. Health New Zealand says the action could disrupt treatment, services and care over the entire week, especially for patients with non-urgent needs. It's while the Health Minister, Simeon Brown, has criticised the strikes, saying they'll disrupt more than 13,000 surgeries and appointments. All this after a year of deadlocked negotiations between the union and Health NZ. Today on the front page, union delegate and healthcare assistant at Christchurch Hospital, our Dietschin, joins us to tell us what it's like on the ground and at the picket line. So first off, Al, tell me, why have nurses decided to go on strike?
Okay, so nurses, midwives and HCAs that are NZNO members are striking essentially because our health system is completely overwhelmed. Staffing levels are in an atrocious state, and short staffing is, it's chronic. It's been ongoing for quite some time, and we've just had enough of it. We're tired. Christchurch Hospital, where I work, over the weekend has been in code black. The hospital's bursting at the seams, and wards are working chronically understaffed day in, day out, and people have had enough. I'm on the bargaining team with NZNO. We've been in bargaining now for since September last year, so roughly a year. And Te Whatu Ora have failed to address any of our key claims.
I mean, this isn't the first time we've spoken about understaffing issues. Why hasn't anything been done?
Well, I think, I guess the main reason is funding. We have a government that's looking at, that is underfunded health. It's been an ongoing issue for quite some time from successive governments. This government is interested in austerity measures and cuts and that have impacted the front line in health. And it's all around budgets. It's all around sort of how much to spend. And so it's not addressing what is fundamental, which is having enough staff to give the care that we want to give.
Health New Zealand says that the shift below target, or the SBT data, is a moment-in-time measure and not a reliable indicator of understaffing. Now, first off, can you explain to me what that data shows, and how do you respond to that reasoning from Health NZ?
I mean, CCDM, or care capacity demand management, is a tool through TrendCare that measures the acuity of patients and determines the number of staff that are needed on any particular shift. The nursing staff input into that data ongoing throughout the shift, so it's not like a once-off, it's a continuous process, and that is calculated and measures through FTE calculations how many staff we're short. Previously, up until their hiring freeze, FTE calculations have provided uplifts in staffing in many, many areas because of the reason that it's shown that we're understaffed. So being cynical, you could say that one of the reasons is because it's that they wanted to get rid of CCDM and TrendCare, or to sort of modify it, is because it's showing the gaps that exist, and that doesn't measure up to the budget they've allowed. So,
Health New Zealand is also accusing nurses of putting politics ahead of patients. How does the union respond to this kind of criticism?
Well, I mean, it's political in as much as it's about a public health system and the need for a good public health system, and it's Te Whatu Ora that have hit, and the government who have become overtly and politically involved in this dispute. They're the ones that have essentially changed it up and had Judith Collins interfere with it, the public services minister. So I guess you could argue that they've made it political in their approach.
It's not all about money though, is it? I mean, that chronic understaffing, how do we address that? Do you need a guarantee, I guess, from Health New Zealand to say, well, we promise to hire X amount by the end of the year or by a year's time or something? I mean, how do we get around that?
Yeah, I mean, in terms of if you're talking about wages, it's, obviously the cost of living is impacting on our members, and we want a wage increase that keeps up with and addresses inflation. What being offered so far is essentially a pay cut. But in terms of for safe staffing, we need much more money put into the public health system, and we need Te Whatu Ora to commit to continuing the CCDM trend care, and also we have a claim on bargaining around culturally appropriate ratios that would be basically a safety net below the care capacity demand management process, so that we would have a net that would ensure that a certain number of nurses and HCAs are there to provide the care that we want to give, and the care that provides for a good patient outcome.
Right, so those processes that you mentioned, that kind of mathematically we figures out how many nurses should be on a shift or something like that. I mean, on any given day at the moment, can you give me an example of how that isn't working out?
Well, I mean, I can give you just one anecdotal example of where I work that, especially on night shift, night shifts have been chronically short-staffed for some time, and over this winter period, I mean, it's not really the winter period because the pressures on our health system we've seen these numbers even before winter hit. But over winter, the staffing has become dire. We're meant to be staffed to 5 RNs and 2 HCAs on night shift, and regularly one of the staff is redeployed, so we're 4 RNs on instead of 5, and after a certain time there's no HCAs on the floor. So that's just one area, and that's across the board. We're staffing are redeployed to try and fill the gaps, but when there's not enough staff, everywhere gets short.
What are some ongoing challenges that nurses are facing that impact, I guess, retention?
Well, I guess a remuneration package that meets the cost of living and that makes it easier, especially for our members that are, single mothers or single fathers and they're struggling at the moment on a sole income. So wages is essential to keeping people here. But also when you're in an environment where day in, day out, you're becoming anxious and fearful of going to work because of the pressures and knowing how understaffed it is and how busy it is, people burn out and people sort of want to move away from that, obviously. And so, when they see conditions and wages in Australia to be a lot better, then they're going to want to move to that. So it's something in their interest, I guess. But yeah, we don't want to see that. We want to see, a well-funded, functioning public health system that retains our staff. I mean, another aspect of the pressures that people are under when we are short-staffed is the culture that develops, and it becomes very cutthroat, and it's something that we need to address. So, but yeah, I guess also you have to look at the fact that our hospitals are overwhelmed because patients are becoming more acutely unwell. We have an ageing population. Successive governments have failed to address that. I mean, the social determinants of health, whether it's housing, whether it's poverty, whether it's homelessness, those sorts of things. If we had a well-functioning primary health system, we'd be keeping people well longer and keeping them out of hospitals. I mean, the result of our hospitals being overwhelmed is the result of primary health care failing.
Simeon, listen to healthcare workers! Shame on you! Shame on you!
We're here not only for ourselves, but we're here for our patients as well, because they deserve better care than what we're able to provide in these conditions. So we've been pretty clear with our message. We need better staffing, we want nursing ratios, and we want fair pay. And so far the government hasn't delivered on any of that, so we've had to take this pretty historic action of 2-day strikes. Simeon Brown has been misrepresenting the truth and the reality. Up on his window today, he's got a sign saying that our strike is delaying thousands of surgeries. I think he's got 1,300 surgeries, But what he's not saying is the reason there's so many backlogs is because the government has failed to deliver on those outcomes.
I saw that Health Minister Simeon Brown pointed out that the average salary for a registered nurse is now over $125,000 a year, including overtime and allowances. Is this correct?
Well, I would say to that it's actually deliberate disinformation, because in order for your average nurse to earn that much, they'd have to be a senior nurse to start with. They'd have to be working, every shift that earns a penalty, like weekends and night shift, that kind of thing. And that's just, there's only a very, very small number of members that would even earn that much. So it's just deliberately, disinformation, I would say, that sort of is leading the public astray. And then when you look at, like the other members of NZNO that are HCAs that don't earn as much as RN. So, what they're earning is way less. It's only, in the last round of bargaining last time that some HCAs were brought up to the living wage. And, there's a risk of HCA members falling below that again. So, that's a significant number of our membership as well.
Do you get frustrated when you see things like that? Because, the average New Zealander who doesn't really know anything or doesn't have a nurse in their life, say, sees, they must be doing all right because the average wage is over, is six figures. Or they see something like, graduates are getting, $70,000 a year straight off the bat. Like, it must be frustrating that those figures aren't laid out like that. Like, no, not everyone is going to be getting those overnight shifts or weekend shift or Sunday shifts. Yeah.
It is very frustrating. And it's a deliberate tactic, to put out that spin. This government's very good at it. That, like I said, it's only a very small number that would get anywhere near any that amount. We all need, we acknowledge that, many, many working people are struggling at the moment with the cost of living crisis. And, we're not the only ones that are needing wage increases that sort of address inflation and things like that. It's disappointing, but it's not unexpected, I guess.
And what about the claims that nurses are putting patients at risk by striking or going on 2 strikes in 1 week, which is unprecedented? But I suppose one wouldn't become a nurse if you didn't like people.
Yeah, obviously we're in this job because we care, on a personal level. I get a reward out of caring for people. It's something that it's inherent in me. But, that's what caring profession is. It's a role for people that care.
I guess it's hard to put into words how, overworked and overwhelmed you guys are. What's it been like on the picket lines?
The response has been great. We've had the firefighters here again. Massive respect and solidarity with the New Zealand Professional Firefighters Service. We've had the representatives from other unions, from the teachers and senior doctors, that sort of stuff. We've had a lot of support, a lot of public support. Our pickets in March has been very rowdy and very excited, but members are angry and they're frustrated, and they want to see our claims addressed.
And lastly, Al, if you could wave a magic wand, what needs to be done tomorrow?
In terms of bargaining, I think that we need to be sitting back at the table and we need to be having Te Whatu Ora take our claims seriously and addressing them. We have a number of claims that would go a long way to addressing the issues around staffing that they're failing to accept and address. So, that would be a first good step, would be to sit back down at the table. We want to sit at the table and negotiate, but if they're not prepared to even contemplate and accept some of our claims, then there seems to be no point, because they're not coming to the parties. So, that's what we need, is we need them to accept that, what we're saying is correct and that they need to address our claims.
Thanks for joining us, Al.
That's okay. Thank you very much.
That's it for this episode of The Front Page. You can read more about today's stories and extensive news coverage at nzherald.co.nz. The Front Page is produced by Jane Yee and Richard Martin, who is also our editor. I'm Chelsea Daniels. Subscribe to The Front Page on iHeartRadio or wherever you get your podcasts, and tune in tomorrow for another look behind the headlines.